injury is the most common cause of death and several neurological complications. The peripheral and central olfactory structures are located in the medial forebrain, making the olfactory system potentially vulnerable to injury following traumatic force to the head. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about how smell is affected because of head injury. Otolaryngology, head and neck surgery, investigated the associations of prior head injury, number of prior head injuries and head injury severity with subjective and psychophysical olfactory function in older adults and to examine concordance between subjective and objective olfactory function among individuals with and without head injury. The prospective cohort study included 5,951 participants who attended Atherosclerosis Risk in communities or ARIC. Data analysis was performed between November 2021 and May 2022. Self-reported subjective olfactory dysfunction was assessed by the questions: do you suffer from smell loss or a significantly decreased sense of smell? The total of 5,951 participants were female, 1,356 were of black race, and 1,666 had a history of head injury. Participants with prior head injury were more likely than individuals without head injury to report subjective olfactory dysfunction, that is 24% versus 20%, and have objective anosmia, that is 15% versus 13%, but had lower concordance between subjective and objective assessment, 72% versus 77%. In logistic regression models adjusted for socio-demographics and medial comorbidities, including cognitive status, participants with a history of prior head injury, particularly individuals with 2 or more prior head injuries and more severe head injuries, were more likely to self-report subjective olfactory dysfunction and were more likely to be found to have objective anosmia compared with participants with no history of head injury. Findings of this cohort study provides evidence supporting the association between head injury and olfactory dysfunction, particularly among individuals who experienced multiple prior head injuries and among individuals with more severe head injury. The findings also suggest that individuals with prior head injury were more likely to both under self-report and over self-report deficits compared with objective olfactory testing. Therefore, it may be more important to consider objective olfactory testing in this patient population. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.